and seeing them in the hallway, they were just happy and jovial, and they enter the classroom and they're depressed. Like it's something that happened in my doorway.
Yes. Kids do tend to be, if you think about kids in general, they're kind of impulsive, right? So one minute they're thinking one thing, and the next minute they're on to something else, and the next minute, that's the way their brains are wired. So mood is similar. Their mood will change, less like an adult who will get depressed and sort of stay that way. Like I said, will just not have very many moments of good mood at all. You know, the kids might do that. They might look completely, utterly normal at one particular time, and then get depressed rather quickly. Now, typically, if it goes on and goes on and goes on, it's going to be, you're going to start seeing that spill over everywhere. But the other thing I will say is that they're diagnosing some of these things, because we don't have access to blood tests or scans or things like that. It's very difficult, and so if a person doesn't, if the doctor doesn't get the right history, or doesn't or you know the parent gives the history that there's depression or something in the family and things like that, there's a lot of things that can skew that physician into thinking it's depression, and maybe he's got it wrong. Maybe it's ADHD, or it's some other behavioral issue, some stress at home or something like that hasn't reached the level of depression yet. So there are a lot of possibilities, and that's the hard part. Does that make sense? Yeah. Nobody has seen anybody that's been treated for depression and looked differently afterwards? Looked more like their normal self and was better? Has anybody seen that? Okay. So I was going to say, hopefully you have, because otherwise I'm going to be, it's going to be like I'm making this stuff up or something. I can always tell you all the stuff that I see, and that's great and everything, but without you seeing that, that makes it a little hard for you to believe, probably. Yeah.
How do you say that ADHD or ADD haven't connected to depression yet? Are you saying that there is a connection there with those?
Absolutely. In other words, the question is there a connection between ADHD and depression?
Yes.
Is that the question? Yes, absolutely. There's a connection between a lot of these different brain illnesses can kind of go together. So anxiety and ADHD and depression, a lot of these things will go together. And it's sometimes hard to sort out, because what is one of the symptoms of depression? Trouble concentrating, trouble with memory. And in kids, I would say attention is not too far behind. I would think attention might be hard. It might be harder when you're depressed. So, because usually there's some stressor or something else on your mind that's contributing to that depression, and so it's hard for you to focus on your schoolwork and other things. So it's pretty hard to sort out. And again, not being a child psychiatrist, I'm certainly not an expert. I haven't seen thousands of kids that can tell you right away what this is or that is. But all my colleagues, you guys heard Susie Creer, Dr. Creer, at the end of last year talk about ADHD, and she mentioned that in her talk, if I remember correctly, that ADHD and depression go together quite a bit. So it's something to keep an eye on. I mean, certainly if you have a child that has one or the other, kind of make sure you're thinking about those things. Okay, now, what happens? Let's say you go to the doctor. Let's say you start thinking there's some depression. What should the doctor do? Hopefully the doctor will take a good history from you. And he may do some blood tests, but he may not. The first time you see the doctor, he may right away know it's depression, and he may not be worried so much about anything else, thyroid or anything else. And it sort of depends, too, on the age. If I'm seeing an older person who's depressed, I tend to check more of the blood tests, like the B12 and the thyroid and all that stuff, a little earlier than I would in a younger person. But usually he'll do some history, a physical exam, and he'll do some blood work, okay? The key thing for you guys to realize, either if you're the patient or if you're going with a family member, is that you need to have a family member there. Because depression kicks in kind of slow and kind of gradual, and sneaks up on you. So if you're the person with depression, probably you're not able to tell the physician what the history is as good as a family member might be able to. So be okay with your family member coming in if you're depressed. And if you're a family member, assert yourself with the physician a little bit. Make sure the physician hears you. That this is a 3-month thing. It started kind of slow and gradual. I wasn't sure what was going on, but now he's really starting to slip into being more irritable, and he's not really enjoying anything in life anymore. He's withdrawing to the house, doesn't visit with his buddies anymore, doesn't want to hang out with me and the kids anymore. He sleeps 14 hours a day now, and different things like that. You've got to let the physician know that, because then the physician is going to start thinking depression. Otherwise, he may completely miss it. So give the history. The other thing that's important is, has there ever been an episode before? You'd be surprised how many times I have to ask that from people. They won't just tell me, yeah, I was like this 2 years ago, exactly the same thing, and they used this, and this is what helped. They won't even tell me that, unless I ask, and then I ask, and finally I get that, but it surprises me. Why wouldn't you think to tell me that? So you got to tell the doctor that. It helps them. If something worked for you in the past, it might work for you again. The other reason that's important is because if you've had more than one episode of depression, do you suppose it's likely you might have another? Probably. I mean, the evidence is that the more you have, the more you're likely to have, and the worse they get each time. So my rule of thumb is if somebody has 3 episodes of depression in their life, that means it's pretty easy for them to get depressed. Remember the genetic stuff I was talking about? Maybe that's one of those folks. If they have 3 or more episodes of depression in their life, I think it's probably worth the risk of staying on the medicine for good to keep them out of that depression again. People might argue that, but that's what most psychiatrists and most doctors that treat depression feel, is the 3 or more episodes. And there are times where I'll even say, like, let's say somebody has a family history of depression, 2 suicides in the family, that's a pretty thick family history. That's a pretty scary illness in that family. If they've had 2 episodes of depression, not even 3, maybe just 2, I might say, guys, or Mr. Smith or whoever it is, you really need to stay on this medicine because your family history is pretty thick. It's pretty harsh. So tell the physician, how many episodes have you had? Did they look the same, and what worked? And family history, if there's a family history. Now, how do you treat it? There are different ways to treat depression. I'd say the first thing let's talk about is psychotherapy. Okay, you guys have heard of Sigmund Freud? Okay, well, we don't really do things like Sigmund Freud too much anymore. You can find somebody like that on the East Coast if you want to drive pretty far away. Most folks, I do some therapy or have done some therapy. Mr. Rogers over here has done some therapy. Therapists nowadays are more interactive. They'll sit there in a chair with you right across from you, and you'll talk. You'll tell them about things that are going on, thoughts that you're having, feelings that you're having, and they help you kind of process that stuff. Like one of the forms of therapy is sort of a brief type of therapy that's 10 to 12 sessions, and what it does is a lot of folks that get depressed, they have sort of automatic negative thoughts. I'm no good. Everything I touch is a failure. I can't do anything right. Everybody would be better off without me. These are all sort of common negative thoughts that people with depression have over and over again, okay? A therapist will help you to start challenging some of those thoughts because they're not true. If you ask your family that, they'd say, no, you're not a burden to me. I love you. I want you around. But the depression is what's making you think like that everybody doesn't want you around. So you got to challenge that, and that's what the therapy does. Now, the problem with psychotherapy is if you can't concentrate and focus very well, if you're more moderately or severely depressed, you probably should not just do psychotherapy alone. Certainly it's okay to start it and everything, but you probably need to start medicines and the psychotherapy at the same time. I think anyone and everyone can benefit from psychotherapy and probably should be in psychotherapy when they're suffering from depression at some point. Whether you start it right away or whether you start the medicine first, give it time to work, ease a little bit of the concentration problems, memory problems, so the person can focus a little better and retain what they're learning in the therapy sessions. There's some argument for doing that too. So either way, psychotherapy is probably a necessity in my mind. Studies have shown that it works with the medicines. It works better than either medicine or psychotherapy alone if you put them together. Medicines. Has anybody heard of antidepressants? Prozac? Anybody heard of that? Okay, are they speed? Anybody know? Is it sort of the same thing as cocaine? Does it get you high when you take it? No, it doesn't really. I mean, if you don't know that and you're wondering, well, how can you say that, doctor? Well, the easy way to do it without listening to me is just ask around the streets. Hey, is anybody selling any Prozac? Hey, you got Prozac? Hey, I'll give you $100 for a Prozac tablet. You think you're going to get too many buyers or too many people around the streets that are asking to buy Prozac? Probably not too many. And Xanax, yes. I heard of Xanax out there. Yes, you are. And I'll talk about Xanax in a second. It's not an antidepressant, though. It doesn't do anything for depression. It helps anxiety, and it works kind of quick and fast, and that's why people like it. Prozac, does it work fast? Not really. It takes 4 to 8 weeks for some effect, 4 weeks. 8 weeks, you're starting to get 75% effect or so. By 12 weeks, you should have full effect.